Hey everyone, Dr. Brianne Callanan here. In this video, we are going to share important details with respect to the overview of the program. What does the research have to say about a 5-day fasting mimicking diet? And it's quite interesting. There is a lot of arguments and a lot of controversy, especially on social media when it comes to fasting. Individuals who are stressed shouldn't fast. Individuals who have autoimmune conditions shouldn't fast. Individuals who have low DHEA shouldn't fast. Individuals with Hashimoto's or thyroid-related concerns shouldn't fast. And while there's a lot of controversy on social media, the research is not gray. It's really black and white when it comes to the benefits of fasting for longevity, metabolic health, and we're going to specifically be focusing on the 5-day fasting mimicking diet in this video, as well as the benefits of that particular program. But I'm going to touch on some various different ways that you can fast as well. Some of the points of the research with respect to what are the benefits of each of those types of fasting. And that way, when you're done the 5-day fasting mimicking diet, perhaps you could incorporate some other fasting regimes or try it out and figure out what's going to work specifically best for you. So I'm going to go ahead and share my screen. We're going to go through this presentation together. And then, of course, if you have any additional questions or concerns, make sure to include those in the app group chat or in the private Facebook group as well. So the first thing I want to go over is the popular types of fasting. And the thing that's really important to remember here is that fasting, at least in the way that I'm describing it, is not the same as chronic caloric restriction. Restricting your calories chronically over time does have some negative health consequences. It does have metabolic decompensation, meaning that your metabolism is going to lower to compensate eventually for that caloric restriction. And we typically see that around week 6. Now, it's very, very important. Again, caloric restriction is not the same as fasting. It's also important to keep in mind that some individuals will fast as a strategy to lower their calories. But again, I do not in any way promote long-term caloric restriction. The first fasting approach that comes up here on this graph under the caloric restriction is the alternating day fast. This is where you fast for a day and you eat regularly for a day. Fast for a day, eat regularly for a day, and alternate one after the other. Periodic fasting may be 2 days a week that you do fasting, and then you are consuming your meals regularly on the other 5-day. Time-restricted eating, this is where you consume all of your nutrients within a specific window. This is the most common type of intermittent fasting or time-restricted eating that I see in my practice or on social media, where individuals will do something called 16-8, where they will fast for 16 hours and they will eat all of their meals within the 8-hour window. Now, on the fasting mimicking diet, when we are fasting for those 5 days, or we are specifically only consuming very specific foods to mimic the act of fasting, I would recommend you consume all of those foods within an 8-hour window. So the nutrition plan that I provided you, yes, you can space that food out as much as you want, but I would recommend trying to keep it within an 8-hour window. Long-term fasting would be fasting typically considered fasting greater than 3 days is what we would consider a long-term fast. Now, fasting mimicking diets are getting all of the benefits of the long-term fast while still being able to consume some calories. So essentially, we are tricking the body into thinking that it's fasting, or ensuring that we are producing the same outcomes of a long-term fast while still consuming some foods. Now, there's also supplementation such as resveratrol that can produce some of the metabolic outcomes similar to fasting as well. We're not going to discuss additional supplements and things like that. There is a little section in the program to talk about, basic supplements that I like for a maintenance of good health. I'm a really big proponent of Bifidobacterium B420 for metabolic health and weight loss. That's a very specific probiotic. I'm a big proponent of magnesium. That's the most common mineral deficiency, vitamin D, as well as omega-3s. Omega-3s are anti-inflammatory, amazing for obviously reducing inflammation, increasing antioxidants, great for metabolic health, reducing cholesterol levels, making sure you're having enough of that good HDL, as well as if we go back a step to the magnesium, magnesium is the most common mineral deficiency. So as you've seen here with the supplements, we're talking omega-3s, magnesium, probiotic, and vitamin D. Vitamin D, many individuals are still deficient over the summertime. Now, as you can tell, those are basic supplements for the maintenance of good health, just giving your body what it needs in order to function optimally. There's nothing gimmicky or, ketones or red raspberry or any of those things, just the basics. The other thing that I want to mention very early on to you with respect to the benefits of fasting is you need to be hydrated when you are fasting. You need to be consuming at least 3.5 liters of water each and every day. I'm not asking you to consume more water than you need. Many individuals, when I say 3.5 liters, absolutely freak out. I can't do that. I'm not asking you to consume more water than your body needs. Your body needs at least 3.5 liters of water each and every day. While you wait to do the fasting, or if you've got a couple days before you're starting, try to at the very least start getting a 3.5 liters of water in. That's going to be very important. The 5-day-a-month fasting mimicking diet. Okay, what is this? This is a specific form of fasting where you fast for 5 days out of the month, or you consume the foods that I've given you on the plan that helps to mimic fasting 5 days of the month, and then you eat a regular healthy whole foods diet for the rest of the month. FMD is a modified fasting diet in which you consume small amounts of food in a way that still provides the benefits of fasting, but promotes healthy aging, improves longevity, can help with weight loss, improve your cardiovascular risk, improve cognition, your mental health, reduce that brain fog, support the immune system, and your overall metabolic health. This nutrition plan contains very specific macronutrients. It aims from 43 to 47% daily intake of carbohydrates, 44 to 46% of your daily calories coming from fat, and 9 to 11% of your daily calories coming from protein. Now, if you followed me for any length of time, if you joined my metabolic reset program, if you've worked with me one-on-one, if you've listened to me on social media, you'll know that I'm a big proponent of protein, 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 protein. This is just 5 days. We are doing 5 days to improve biomarkers of longevity. We are doing 5 days with the goal of reducing inflammation, reducing markers of insulin resistance, reducing IGF-1. And in order to do that, we do actually temporarily need to reduce protein. Proteins contain amino acids. These stimulate growth. And what we're trying to do through this 5-day fasting mimicking diet is reduce growth. If we reduce growth, we upregulate another process called autophagy. Autophagy is really important for anti-aging, and it's really important for cancer prevention because the act of autophagy actually causes the breakdown of cells and proteins that aren't behaving properly. So in order to get the benefits of autophagy, we do need to temporarily reduce that protein for 5 days. Now, many individuals, when they see this, they absolutely freak out and say, oh my gosh, I'm going to lose my muscle mass. The research does not suggest that. So temporarily reducing your protein for 5 days, as long as you have your protein intake up for the rest of the month, actually has been shown to have positive benefits on the overall growth of lean muscle mass. It's the chronic caloric restriction over time, long periods of time, that breaks down your muscle mass. In addition, what we know with respect to chronic blood sugar dysregulation, chronic inflammation, chronic stress issues, that's detrimental on your metabolism. That's detrimental to your lean muscle mass. That promotes weight gain. And through doing the 5-day fasting mimicking diet, we're reducing inflammation. We're reducing the risk of insulin resistance. We are making improvements to immune system markers that generate the inflammatory response, such as cytokines. With respect to this overall nutrition plan, the first day has higher calories. They're not high by any means, but it's a little bit higher than days 2 to 5. The first day has about 1,100 calories, whereas day 2 to 5 contains approximately 725 calories. Now, I want to make it very simple. I recognize that there are a variety of individuals with different health concerns, with different body types that are joining this group. I have tried to make it so simple so that you are not stressing about meal prepping, because that's not the point. We want to take the stress off. We want to make this as easy, as enjoyable for you. And the last thing I want is to stress you out about having to do all of this fancy meal plans. I don't personally want to cook a whole bunch of different soup recipes and then be the only person in my family to consume them. So I've tried to make the nutrition plan very simple, very user-friendly, basic whole foods that don't require a lot of cooking. Now, with respect to customizing this plan, each and every individual, to get the benefits of the 5-day fasting mimicking diet, has different caloric needs, and I recognize that. So an individual with a higher body mass will require or will be able to get away with consuming more calories and still getting the benefits. An individual with a leaner body mass or a lower body mass may need to reduce the calories of the nutrition plan in order to get the full benefits. There is another section at the very end that talks about how you can customize the calories and macros specific to you based off of your body weight. I would highly recommend for your first time to just follow the plan, make it easy, follow the nutrition guide that I have laid out for you. If you are not new to fasting, if you've done longer fasts before, if you are aware of macros, then yeah, go into the last section and have a look at how to calculate those macros, have a watch of the video and try to customize it to you. But again, if that's overwhelming, just follow the nutrition plan that I have laid out. Benefits of the 5-day fasting mimicking diet. We know that there's benefits to cognitive function. It influences the immune system. So we may even see improvements in breathing and asthma symptoms. In the liver, we deplete something called glycogen. So all of the glucose is stored as glycogen, and a lot of that is stored in the liver. What we first have to do is we have to deplete all our glucose or sugar stores, deplete all that glycogen before our body can switch over to burning fat for fuel, which is ketogenesis. And we often have to see longer fasting periods to get that benefit. So that's why we're doing 5 days. Improvements in insulin sensitivity. 1 in 2 individuals in North America have issues with insulin resistance. And this is something I test each and every patient for in my practice. And there is links on my website. If you want to get your own blood testing to see where your insulin sensitivity is, you are welcome to use those links to order your own blood testing. The muscles, we see improvements in insulin sensitivity. We see improvements in muscle growth. Again, it's that chronic caloric restriction that's the problem, not fasting. We see reduced inflammation, reduced risk of sarcopenia. Sarcopenia is the breakdown of muscle in the extremities. And when we see that, we see increased weight gain around the organs or increased visceral fat. With respect to sarcopenic obesity, this is a real problem where it's not just that individuals who are struggling with their weight have more abdominal fat, or especially around the organs or the visceral fat, but they also have this breakdown simultaneously of the lean protein or the lean muscle mass, which is really dangerous in terms of your overall metabolism, talking also about risk of osteoporosis and falls. Fasting has benefits on reducing blood pressure, improving your cholesterol markers, reducing your overall risk for cardiovascular disease. Of course, we can increase lipolysis, which means fat breakdown, decrease inflammation. All of these things are really great. In the intestines, we see benefits to the gut microbiome from fasting. Specifically, we see a reduction in the FB ratio, which is associated with leanness, absorbing less calories from the foods you eat. Fasting increases a beneficial bacteria called Akkermansia muciniphila. This is the bacteria that we see low in people struggling with their weight. If you don't have enough Akkermansia, you are going to, again, absorb more calories from the foods you eat, have higher levels of inflammation, higher rates of leaky gut. We're also going to see issues with inflammation in the intestinal tract, issues with metabolic disorders. So fasting is a great way to increase Akkermansia. In the supplement section, I talk about Bifidobacterium B420. That is the probiotic strain in my tummy tone product. That has also been shown to increase Akkermansia. So another way you could use supplements to supplement your fasting protocol. Of course, weight reduction, improved body composition, reduce cancer risk, reduce inflammation, all really great things. This is what I like to say over and over and over again. Fasting is controversial on social media, but it's not controversial in the literature. This is review studies. This is all of the literature reviewed, summarized what the research has to say. These are all the different types of fasting that they had to look at. These are the patient populations that the study was used in. So for instance, this was a 16-week study right off the bat. They fasted for 10 to 12 hours. These were overweight and obese patients, and they saw a reduction in body weight by 3.5%. That's amazing. 8-hour time restriction, 2.8%. 6-hour restriction, decreased body weight. So this is showing about, if we look at individuals who are overweight and obese, if you do some 8-hour fast or 6-hour fast, right off the bat, you're looking about 2 to 4% reduction in total body weight, which is great. Now, when we were looking at 5-day fasting mimicking diet, so 5 days out of the month, this was quite interesting. If you look at the very top, this study actually used healthy subjects. So these individuals did not have type 2 diabetes, they were not overweight or obese, and we still saw a body weight reduction of 3%, which is really great. So individuals who are overweight and obese would benefit even more from the 5 days a month. And this is really great for individuals who are busy or have hectic lifestyles if they just want to dedicate that 5 days a month to the fasting. And then the rest of the month, they again are not calorically restricting themselves over and over and over again, but they're looking at ways that they can ensure that you're getting enough macronutrients, their proteins, carbs, and fats from healthy foods, which we can also help you with. Other types of fasting can be seen here with the body weight percentage and reduction. Overall, I would say you can expect to lose anywhere from 2 to 4% of body weight by incorporating some sort of fasting regime, and specifically the 5-day fast has some really great benefits to it. There was one thing I actually wanted to point out here on this 12-week study. So these individuals had an 8-hour time restriction. They did it for 12 weeks. So consuming all your foods within an 8-hour window for 12 weeks, the participants were overweight and obese. And I love this study because look at how they broke it down. They actually broke the groups down into those that sleep really good and those who are poor sleepers. So what they found in this study is that you could lose 5.2% of your body weight by doing an 8-hour time restriction if you are a good sleeper. But if you didn't sleep well, then you only lost 2%. So this highlights the importance of also looking at other things like sleep. So if you are not sleeping, this is something that I really want you to try to prioritize. In the supplement section, I talk about the benefits of magnesium. Magnesium often can be quite helpful for individuals for sleep. Also practice good sleep hygiene. We'll be discussing sleep a little bit more in the group. If you are having a hard time sleeping, you could also consider something like ashwagandha, an adaptogenic herb, melatonin. Again, please ask your questions in the group. Pick my brain when we have those 5 days together. If you're struggling with sleep, we can brainstorm some ideas to help you, because sleep is really important for your blood sugar, Alzheimer's risk prevention, cardiovascular disease, and of course your mental health. Not sleeping is not fun for anyone. A little bit deeper into the physiology, we covered a lot of this already. Fasting reduces inflammation, it improves appetite regulation. It has been shown to also increase antioxidants. The other thing that we need to recognize is fasting allows us to rest the digestive system. Anytime we are consuming foods, our body is diverting energy to digest. So we're not resting. So what I want you to think about is when you're fasting, you are actually increasing the activity of something called the migrating motor complex. This you can think of as brooms in the intestine. So it's really like they're sweeping the food along. So if you're struggling with constipation and you're eating all of the time, that can actually make constipation worse. So by allowing the fasting, we can see improvements in the migrating motor complex. We can see improvements in diversity of the gut microbiome through fasting. We can also see improvements in Akkermansia, that really important bacteria we talked about for weight loss. In addition, we see increased amounts of something called short-chain fatty acids. Short-chain fatty acids are what the bacteria produce that help the intestinal cells be healthy. So that's really important, especially for patients with leaky gut. We see reductions in insulin as well as IGF-1. My apologies, I should say IGF-1. These are growth factors. So we don't want growth factors for cancer patients. We don't want high growth factors for patients who are struggling with resistant weight loss either. So we see the benefits there. Neurological support and ketone production. Ketones are really beneficial for cognition in the brain. And of course, increase protein and cell turnover. That's the autophagy, that's the longevity, anti-cancer benefits. Results from the fasting mimicking diet, we saw weight loss, decreased blood pressure, reductions in insulin resistance. Reductions in insulin resistance was actually much better than just with caloric restriction. Decrease in IGF-1. We see really big improvements in cholesterol panels, reductions in triglycerides, cholesterol, LDL, the bad cholesterol. And we tend to see mixed results with the marker CRP, although it's generally positive. Now, what is CRP? CRP is a blood marker for inflammation. So the reason why I think the results are mixed on this is because CRP does not tell us where the inflammation is coming from. So you could have higher levels of inflammation from an injury. You could have higher inflammation if you have celiac and you're not consuming a gluten-free diet. You could have an underlying autoimmune disease that we haven't picked up yet. CRP is non-specific, so it's a little bit more challenging to figure out where that inflammation is coming from. Now, what are the negative events that we hear about when it comes to fasting? So we hear about the reduction in lean body mass. If you combine fasting with caloric restriction long-term, specifically more than 6 weeks, we will see a reduction in lean body mass. The 5-day fasting mimicking diet has actually been shown to stabilize and increase lean body mass, not decrease it. Then we hear about, okay, fasting increases cortisol. Not the case. If we actually look at the research, what does it say? There is research to show that the morning cortisol will increase with fasting. So the cortisol awakening response. Your cortisol should jump up and be high in the morning. That is normal. That gives you energy. That gets you out of bed. So having an increased cortisol awakening response is not a bad thing. In fact, if you don't have your cortisol rise in the morning, that can contribute to fatigue, and it's been associated with a lot of autoimmune conditions. So having an increased cortisol awakening response is not a bad thing. What we do see from the research is, yes, the cortisol awakening response goes up, but there is not an increase in total cortisol. And that's really important to note. What we do know is individuals who have extra body fat, especially the fat around the midsection, that body fat can pull in cortisone and actually activate it to cortisol. So the more body fat you have, especially the visceral fat around the midsection, the more issues with cortisol you're going to have. So by implementing a strategy like the 5-day fasting mimicking diet, which has been shown to reduce body fat, we are actually able to make improvements in cortisol levels, because the less body fat you have, the less opportunity for that fat to convert cortisone to cortisol. So the fat cells actually produce cortisol. So if we can implement a strategy to reduce the fat, we're going to be producing less cortisol overall. The last thing you hear of is fasting will decrease DHEA. DHEA is an anti-aging hormone. We want to have good amounts of DHEA. Now, what does it show? Yes, after day 3, DHEA levels are actually reduced, but it does rebound, which is really important, that when you discontinue the fast, the DHEA comes back up. Now, this is where we have to look at each patient as an individual. Why is DHEA reduced? Why do I see DHEA reduced in my practice? I see a lot of patients struggling with low DHEA, low resiliency, burnout, low anti-aging hormone. Why is this? In my opinion, fasting will not significantly increase or add to the individual's source of stress. The biggest stressors that I see in patients in my practice is not work, is not the kids, is not issues with relationships. It's actually the blood sugar dysregulation, the inflammation, the changes to the gut bacteria. Many of my patients have such chronic concerns with insulin resistance, inflammation, poor gut health. That is what I believe is the underlying reason why the DHEA is low. And if we can implement fasting, which improves the blood sugar and improves the inflammation and improves the gut bacteria, Overall, I think that's more beneficial than not doing it and allowing the dysregulation to continue. So can it be detrimental for individuals with already low amounts of DHEA? Perhaps, but it also could be really beneficial for the DHEA levels because it's working on the underlying issues, which are lowering the DHEA in the first place. And I hope that makes sense. If that's not clear, post your questions in the group. I'm happy to clarify that. I think the biggest culprit and the thing that I see most commonly in patients in my practice is their blood sugar is not working well at all. It's up and down, up and down, up and down. That's leading to low energy. That's leading to ups and downs in mood. Even 50% of anxiety can be attributed to blood sugar dysregulation. My patients are feeling puffy, lethargic, brain fog, fatigue, not like themselves, joint pain, stressors, less resilient overall. And the benefits of a 5-day fast can be quite instrumental in changing their overall health trajectory. Who should not fast? Individuals who are pregnant, breastfeeding children, individuals with type 1 diabetes, or who are more prone to hypoglycemia, perhaps would want to be very cautious or work with a health practitioner. Intermittent fasting, 5-day fasting, etc., is not appropriate for anybody with an eating disorder, current or past, as well as perhaps individuals with poorly managed thyroid disorders. So if you have a thyroid disorder and you're working on getting your medication levels right, or if you have a thyroid disorder that you're not on a medication for, or if you have really significant hypothyroidism that you're not getting that treated, maybe have a look at treating the thyroid first before putting your body on more of a longer fast. Now, this is what you have signed up for, the 5-day fasting mimicking group plan. So you are going to get access, and you probably already have access if you are watching this video, to the meal plans, to the videos, to the app, as well as the workbooks and the recipes. Now, you know from watching the other videos that we are going to do this all together May 22nd. And on May 19, that's when I'm going to start allowing people to come into the Facebook group. That's when I'm going to start answering your questions on the group chat. Every day in the Facebook group, I'm going to be posting a live video. If you don't have Facebook, that's okay. Don't stress. I will be recording these videos and also posting those recordings within the app. Now, many individuals who sign up for this program, they get access to all the information they want to start right away on their own. That is fantastic. If you want to wait and do it with the group on May 22nd, I invite you and welcome you to do that. That's when I'm going to be doing it as well. And be patient with your questions. There's going to be a lot of us joining this group together, and I'm going to start again on May 19th, going in and getting all of your questions answered so that you can feel confident in completing this plan. Now, moving forward, you can always join us for next time that we do the 5-day fasting mimicking diet. If you like that group support, or you still have access to all of the resources and materials, you can simply go and repeat this on your own. So I look forward to welcoming you into the program, and I can't wait to do this together. All right, hope that helps. Talk soon.